Hi, I'm Tom, a developer and AI engineer at the Belgian healthcare startup. In our work with hospitals, we see that doctors still rely heavily on free text for their clinical documentation. They're used to it, it's flexible and it works for them. But that means a lot of valuable data, things like diagnosis, medications and vital signs, stay locked in plain text. TIRO.marker fixes that. It reads along while the doctor writes or dictates and extracts structured data automatically without changing their workflow. For the first use case, you saw me pasting a clinical text. Say I'm a researcher and I want to study blood pressure control across diabetic patients at my hospital. I've got thousands of old consultation reports sitting in the system. I define a simple questionnaire with 5 fields. Then I grab one of those legacy reports and I paste it in. So now what happened? There's a two-phase pipeline. First, Mark agents scan the text in parallel and highlight which sentences are relevant to each question. Then populate agents take only the marked text for their specific question and extract the answer. This split is what prevents hallucinations. The populate agent never sees the full document, only the context the mark agent pointed to, and if nothing was marked, it stays empty, no guessing. Now let's look at this one. The systolic blood pressure is filled in, but the text never says the word systolic. It knows that in blood pressure notation, the first number is systolic. Now imagine running this over 1,000 reports, you'd have a structured research dataset in minutes. For the second use case, we're going to do some live reporting. Let me switch to another questionnaire and dictate a case using the MedASR model. So this is a 62-year-old male, came in yesterday afternoon at 2 o'clock with crushing retrosternal chest pain radiating to the left arm. He was alert on arrival, GCS 15. The pain started that morning around 8 o'clock. He rates the pain an 8 out of 10. Vitals were concerning. Tachyardic 110, saturation down to 94%. Body temp was normal at 37.2 degrees. We triaged him as critical. He's on aspirin 100 mg daily PO, metformin 500 mg BID orally for his type 2, and atorvastatin 20 mg once daily oral. Working diagnosis is STEMI, anterior wall. Last oral intake was lunch yesterday. Cardiology is on their way. We're prepping for emergent PCI. So the populate and mark agents are doing their thing. You can see the medication has been filled in and the dosages are correct. And also initial diagnosis is filled. The model knows that STEMI is a type of acute myocardial infarction. So that's TIRO.marker. As you can see, the two-phase pipeline of mark and populate agents really helps with the quality of the extraction. And because every answer traces back to the source text with the AI's reasoning, it's easy to verify what the AI did. Hopefully this video helped you understand TIRO.marker a bit better. Thank you for watching.